I'm Shaun Gallagher, Director of Social Care Policy in the Department of Health, and responsible for a range of activities through the Care Bill and reform of social care policy. And we've got a fantastic panel of speakers here today to talk about the key question of how do we follow up on the re-energising of the personalisation agenda that was talked about by Sam downstairs, that came from a summit that was chaired by Norman Lamb just a couple of weeks ago. And the intention is really that we do two things in this session. One is to share some of the discussion that happened that day, because obviously only a certain number can ever be in a summit of that kind, and we want to make sure that we're reaching out to everybody to ensure that we're drawing in everybody's experiences and views, and to understand those discussions that took place at that meeting. And then secondly, to move on to what next, and so what are we going to do about it? And I think Martin and Bridget in particular are going to be leading some activity where we'll be asking you to do some stuff and start feeding into that. So I'll be handing over shortly to Sally and Sue, who will take the opportunity to introduce themselves when they speak, and who I think are doing a double act. Followed then by Martin Routledge, who will say a bit more about what actually took place at the summit that was a couple of weeks ago, and then Bridget will follow on in terms of the activities that we go through. So just very briefly, from my point of view and from the Department of Health, just to kind of set the context for this, I just want to say a little bit about where do we think we're at on this journey of personalisation that we've been engaged on for quite a number of years now, and a bit of why did we feel the need to have a summit and for the Minister to say, let's call people together and work out what we need to do to move things on. So where are we at? First thing, I think, if we take a step back and ask ourselves, how is progress going on personalisation? There is a huge amount to be really proud of, and I think we mustn't forget that. Overall, over the period of time that we've been working on this, the agenda of personalisation in social care and moving out to associated healthcare is a great success and a story of great progress. Something that started as a rather disruptive movement of a few rebels demanding better control about how systems worked for them or didn't, and was very at the margins, rather maverick probably. First response certainly from government was to say, we've got to stop this, we've got to stand down on it. And something that had its origins in that sort of rebel movement has become, I think, pretty much mainstream and a shared view and a collective ambition across pretty much everybody engaged in this sector. And that is something that's just fantastic to see as a progress that we've made. A second thing is, throughout that journey, and as we've built and developed how we can make care work for people for their own needs and more personal to them, it's been done throughout with co-production and partnership and absolute involvement of people who use care services and those who work with them at its heart. And so I think in particular the way that TLAP has taken on the co-production advisory group and built that into everything that happens, that's not something that you will see in every other public service and every other change and reform journey in public services. I don't think we'd be able to say that it has that sense of a spirit of cooperation and partnership with everybody involved. And so that's something to be proud of as well. And then finally, we're now on the cusp of taking that vision and ambition of personalised care and embedding it in the very foundations of the system through the Care Bill that's going through Parliament and that has benefited from so much involvement and input and consultation from people as it's made its way through development. So that offers a real opportunity to do what one of our previous ministers used to say, to move from you make achievements on personalisation despite the legal framework, to making personalisation at the very heart of the legal framework and that defines how it should work. So those are all fantastically positive things, but I don't really need to tell you that actually there are massive challenges yet to be faced. First thing, just on the question of progress of personal budgets and direct payments, in terms of the development and growth of those, are we making the pace of change that we wanted to see? Is progress stalling? Are we seeing quite a degree of variation between different parts of the country? And I think there's a concern about what we need to do to respond to that. Second thing is, it's never just about personal budgets and direct payments. You have to have the whole system working around that and to support it, so you need the right empowerment and information for people to feel that they can exercise choice meaningfully. You have to have the right services and a range of them so that actually you can do something with the choice once you've got it. And you've got to have everything pulling together. So have we really got all of those coming into place? And then finally, the really big question is always, is it real? Is it having the impact that was at the heart of this? We never said what we really want to achieve is a certain number of personal budgets. We've often said in this debate, if you fall into chasing numbers and looking at targets, you can get to the position where you hit the target but you miss the point. So underneath all of this, what are we actually trying to achieve for people is that they feel absolutely a sense of control and empowerment over how the care and support that they get helps them to live the life that they want to have. And how do we make sure that that is what we're pressing for, measuring, monitoring and scrutinising, rather than just the crude question of are the numbers going up as they should be. So all of that is a really big agenda of things that we need to address ourselves to. And earlier this year, I think one of the things that really brought that together and spurred Norman Lamb into saying we probably need to really do a bit of re-energising around this was a letter from In Control and a range of other organisations that said we've made a lot of progress, but do you know what? With personalisation, we're now at a crossroads. We're at a point where this could really start to be real and the foundation for the future, or it could start to lose a bit of its credit by increasingly pulling the rhetoric away from the reality that people experience, and we've got to make sure that that doesn't happen. So that's all I'm going to say. That's the ambition that was behind the Personalisation Summit, and Norman Lamb and indeed all the rest of us working with him are absolutely committed to taking things on and making it work. And we'll move on to hearing a bit more about the summit itself, and then over to you for what do we do next. So I think Sally and Sue, I'll pass it on to you.
My name is Sally Percival.
And I'm Super.
And we are a double act, but we are not going to be singing and dancing. You will be very pleased to hear that. No, you'll be very pleased to hear
Yeah,
that.
unless you pay us, of course. Then we might consider it.
Might pay us for us not to do it. We are both members of the National Co-Production Advisory Group. The National Co-Production Advisory Group, for those who aren't familiar with it, is a group of people who use services, carers and family members, who work alongside and with TLAP, think Local App Personal, to really push forward personalisation. I am passionate about personalisation. I'm a carer, and the reason I'm passionate about personalisation is because it's worked so well for my family. I care for my son, Alexander, wonderful young man who's 22. He has autism, a learning disability, mental health problems, a host of labels, but he is a wonderful young man who loves World War II reenacting. What his personal budget has enabled him to do is go to reenactments without me alongside him, without him hiding behind my skirt, which he used to do when I was there. It's allowed him to flourish in every aspect. His community is the World War II reenacting community, and he has become a really important part of that community. So it isn't just about a personal budget that's monetary, it's about being involved and leading, what that leads to, and leading him into a community. I also care for my mother, who has dementia and quite complex health needs. She was, at crisis point, placed into a care home, and it did nearly kill her. A personal budget that we fought for, it wasn't without difficulty getting a personal budget for my mum, and very different from the culture of the learning disability services, but we did eventually get a personal budget for my mother. We brought her home to our own home. We employ together, we employ several staff members. They love her. She trusts them. She knows them all very well, and she lives a really happy life. They know her very intimately. My mother only has the ability to move her arms like this. She smokes and she drinks. So they know that. And that's what she's able to smoke in her own home, to have a gin and tonic, to have a glass of wine. That didn't happen in the care home she's in. So that's why I'm really passionate about the difference that a personal budget and community has brought to my family. So I've explained that for many people, personal budgets and personalisation has been very, very liberating. But it hasn't been without its difficulties. And a lot of people have told us that, oh, I'm just going to change it. Is that? No, that's right. A lot of people have told us that councils are being very prescriptive about what you can use your personal budget for. They're saying that you can only use it on care. I faced that challenge. I asked for, my son, as I've said, goes off reenacting. Often those are over a weekend, sometimes a long weekend, and it entails my son's PA and Alexander staying in a hotel, which is quite costly. We have a camper van, and I did ask for a small, and I stress a small amount of money to be spent re-energising our camper van. And it is a military vehicle. It's a Land Rover ex-army ambulance, so it would also very well fit in with the whole army reenactment themes. It would have saved a lot of money, and I mean a lot of money, on hotel bills, guest houses. I was refused because the council couldn't see beyond that that care level. They couldn't think outside the box, and a lot of people are finding that that's a challenge. They've also found that they're being directed to their own services. So local councils are directing people who use services to their own providers and their own council services, which again limits choice and is also much more expensive. So there are challenges to be overcome.
These challenges have come from members of the National Co-Production Advisory Group, and also a very useful exercise that was undertaken in the Northwest. In the Northwest, they got a group of people together in a series of forums who've got personal budgets and said, how is it for you? So this is some of the stuff that they came up with. And it is a challenge, and it is because it's not by way of a demand, you will do this tomorrow. It's a kind of recognition that actually these things are quite difficult. So the system is so complex. So how can we make it simple? And that is a challenge because local authorities have their processes that they have to go through. But from our point of view, we want to be sure that the system is fair, it's transparent. We might not like decisions that are taken, but we are at least entitled to have a clear explanation of why those decisions have been made and when they have been made. I'll say on this thing, this comes up on our information line. We run an independent living advice and information line. It comes up all the time. I've been told so and such and so and such. When were you told? Have you got it in writing? No, I was told over the phone, and that's difficult for people to deal with. And then the second challenge is that we want to ensure that there are good systems of support. Not. I suppose it's a bit like bringing up children. You suddenly land with bringing up a child, aren't you? And you think, how on earth did I do that then? When did somebody tell me how to do that? And you kind of learn as you go along, don't you? And with a personal budget, we don't all know what kind of options might benefit us. And so it's really important to have good support systems, good brokerage systems, peer support systems, where people in a similar situation are saying, well, this is what worked for me, it might work for you. But it is a challenge because, of course, to have those kind of systems needs some resources. But on to the next one. Let's not dwell too much on the challenges and think they're so difficult that we're not going to make it with personalisation. Because there are some opportunities there, of course. I'm actually going to take the second one on the slide first, because I want to end with the most important one. So, integration. I think the integration agenda, that agenda that's across health and social care, but also that integration that's come out of a right to control pilots of people being able to put their personal budgets together is really a fantastic opportunity to make the best use of resources. And if I can illustrate that from one of the members of the National Co-Production Group who he's moved now, and that's another story, but he lived in the London Borough of Newham, which is a right to control pilot group. So he had his personal budgets from various funding streams. He was able to put it all together, and it just made so much sense in his life. So it meant that he could use the same personal assistant who was getting him up in the morning to take him to work and help him at work. And actually, without that, he says that he wouldn't be able to hold down a job in the same way. So, that integration can really make a difference. It's a good use of money. It's silly, really, to parcel money up and say that this bit's the social care bit, so go and spend that bit on the social care bit, and then this is your access to work bit, and it's got to be spent entirely differently and on different people. I mean, that is not a good use of time and money, is it? Put it all together, it's much more effective. So that's a fantastic opportunity. But the most fantastic opportunity of all is co-production. Working with people who use services, and we've moved on now, haven't we? So we're not just talking about involvement, we're not just talking about consultation, come and ask us what you think of our ideas, when we've already had those ideas. We're talking about real genuine co-production that involves us right from the very beginning. So we can come up with our ideas and we can put our ideas across as well as professionals putting their ideas across. We can work together on the design, we can work together on the delivery, because particularly in this age of of difficulties in resourcing. Really, co-production makes absolute sense. I mean, why would you spend money on stuff that people don't want? Doesn't make any sense at all, does it? And that's one of the messages that comes out in one of the TLAP materials that Andrea referred to in her presentation, where we looked at what good resourcing looks like, and I'd add my recommendation to hers to have a look at that. So that's a really great opportunity, I think, to try and get this right.
Hi, so if people don't know me, I'm Martin Routledge. My day job is Head of Operations for In Control, but I work with TLAP on a couple of the work streams, in particular on self-directed sport. And the letter that Shaun talked about, the title of the letter was Personalisation, How to Avoid Snatching Defeat from the Jaws of Victory. You know, myself and colleagues put that letter together from a position of love for personalisation, a sense of this could be something that really shifts us on very powerfully over the next few decades. But also facing the reality, we have a helpline. Yesterday I spent an hour on the phone to a woman talking about what she described as the tragedy of what was happening around personal budgets in her authority. This was a woman who worked in the independent sector and who was parent of a young person with learning disabilities and autism. And she was talking, the tragedy that as she put it, was that we understand and we realise that councils are facing unprecedented financial challenges. You know, it's not been like this before. You know, councils haven't obviously had this kind of experience of cuts before. But what was happening, she described in her authority, was the cuts being done in such a way that personalisation was being destroyed. And the risk is that we don't take that challenge on, I think. So I'm just going to say a little bit about the summit itself. But I think to really stress now is that this process is live. So the summit took place 2 weeks ago. In a month's time, the intention is to, at the NCAS conference, to put out the position. So to say, this is the consensus of these organisations who have responsibility for delivery of personalisation in terms of how we see the position, what we see as the current state of play, what are the remaining challenges, and here are the things that we are going to do about it. It won't be the finished article at that point. So there is a real opportunity at this point for you to include your ideas in the action planning phase post-summit prior to that presentation at NCAS. And Bridget will lead us through an exercise to do that in a moment. So I'm only going to take about 15 minutes setting this up, and then we're going to be taking your practical ideas which will get put into the action planning process. Yeah? Trying to do this in as kind of open and co-productive way as possible. I made the mistake of tweeting a couple of weekends ago what would be your one idea that you would want taken into the Personalisation Summit. And I would say I got about 70% loads of practical ideas and about 30% very strong expressions of scepticism. I think it would be fair to say, some of them not very polite. But what we did was we took those tweets and we put them in the room. So we took all those tweets and all the things that people said on Facebook about this stuff, and we put them in boards on the room for the people in the room to see, including the Minister. I don't think there was anything too rude about him, although he has had a lot of rude tweets of late. So just reminded us why we did this. 5 years since the start of the policy on personalisation, there's been a lot of learning and experience. We're at the end of that kind of target period. Shaun talked about chasing numbers. The DH didn't tell us to chase numbers. Oh yes, they did. But we're end of that period now. It was 30%, it was 100%, it was 70%. You know, that period that ended in March, and this felt like a good time to take stock. You know, we're at the time when the care bill's going through Parliament. It's going to be an expectation that everybody eligible for publicly funded social care using community-based support gets that as a personal budget. So preparing for that is an important thing. So we've got 18 months or so, so it felt like a good time. And there is this sense of both possibility and risk, and this rhetoric reality issue, and you know, what do we do in this period of unprecedented cuts to local government spending? So the idea was lots of discussions going on inside of individual organisations and groups, but there's an important process here of getting synergy across those groups. So not just what are ADAS going to do, or what are the LGA going to do, or what are the provider consortia going to do, but what are we all going to do? Which of those things might we do together? And certainly what can we do in concert to have the biggest impact possible? So it's not just what one organisation does. So what was it? It was chaired by Norman Lamb and John Rouse, the DH Director General. About 25 people there. You know the kinds of people we're talking about. There's a list of who was there, and all the slides from the session are on the TLAP website. We had to decide what the main focus was. We had a half a day of the minister's time, and we could have spread this very wide across the scope of personalisation. We decided to focus in that half a day on personal budgets and market and provider development, but with wider themes coming into the day. And we mustn't restrict the action planning going forward to those two things. Pre-summit, Sue mentioned, we had a meeting in the Self-Directed Sport Forum that took lots of ideas from a wide range of people. About 60 people from all sorts of experiences came and took those into the summit. And at the session itself, we had a series of inputs from people, one of which you just saw from Sue and Sally, where people said, this is this is our take on things, or this is what we know from evidence, and the implications of that in terms of challenges are these, but some opportunities to address those challenges are these. So we had a series of inputs from people doing that, and then the room gathered more challenges and identified more opportunities, and then we went through a process of saying, let's prioritise some of those key challenges and opportunities, and then let's identify what practical action different organisations or organisations acting in concert can do to address them. And that produced us a lot of practical ideas, which are being taken into a process of action planning over the next few weeks, and which you're now going to add to today. You won't be surprised by any of these main messages, I would imagine, but let me share them with you. As Shaun says, an overall picture of good progress on numbers. What we wanted to avoid at the summit was an argument between the information centre's numbers and ADAS's numbers. Yeah? Information centre using the old NI 130 definition and ADAS using a different definition produce different numbers. But the thing about numbers that we did want to talk about was variability. So whether you use the ADAS numbers or you use the information centre numbers, you see significant increases in numbers. However, most of that increase is around managed personal budgets. There's been only a very small increase in direct payments in recent times. But you see massive variations from place to place. One of the stats that was shared on the day was if you lived in the council with the highest percentage of direct payments, you had a 24 times greater chance of getting a direct payment than did it in the council with the lowest percentage numbers on direct payments. That was just used to kind of illustrate the level of variability. So the concern was less about overall progress with numbers, but some concern about variability. You know, why is it that some places just seem to be outliers? The word laggards was used a number of times on the day, and Norman Lamb used that word quite a few times. I think it's fair to say, isn't it, colleagues? And he said, well, let's go around those places, Martin. You know, we'll go around, and I'll tell them to pull the socks up, and you can tell them what to do. And I said, well, there is a function actually in paying attention to those places. But it wouldn't be like that, and he very quickly moved on from using the terminology of laggards and identifying places that needed help. They need to acknowledge that they need help, and then they need to be helped. And ADAS and the sector-led improvement process that ADAS is driving needs to be core and central to that. There's evidence of good outcomes, but we're increasingly clear from the data that we've got, and there was significant use of the National Personal Budget Survey in the summit. It's increasingly clear that people aren't benefiting equally. There are some groups that have less access to personal budgets and some people benefiting less from personal budgets. There's a strong theme of self-awareness. So if we're moving on from a focus on numbers to a focus on results, outcomes for people, surely the least you need to be doing is knowing what's happening to outcomes in your area. So if you're not finding out what's happening as a result of personal budgets around here, and what does that tell us, and how does that benchmark us with other places, and what does that suggest to us needs to be improved, how do you know? How do you know what's going on? We know something about numbers, although there are lies, damn lies and statistics, of course. We know something about numbers, but we actually don't know that much on a live, local basis. We have the ASCOF data that comes through, etc. But on a live, local basis, what's happening as a result of personal budgets around here is not known. So when ADAS did its survey last year, it asked the question, are you systematically checking the results of personal budgets with local people and using the results? Only very small numbers of councils responded that they were at that point. And that links then to the kind of central theme of co-production. And back to the woman that poured out her angst with me yesterday, who essentially was describing a situation, obviously this was just from her point of view, but she was describing a situation where she felt there were powerful, sensible ideas about how to manage the reduction in spend without destroying the essence of personalisation, that weren't being heard, that there wasn't a debate going on, that you had a closed system in her place. Now, I don't know for sure whether that's true or not, but I've heard it from many people. And it's interesting, in Control, we are increasingly, on our helpline or request for assistance, we're getting increasing numbers of people who are working inside of systems wanting to have conversations with us just for thoughts and advice about how to survive and adjust their systems. One of the really helpful things I think that the National Personal Budget Survey analysis does is it allows us to increasingly see what are the conditions that lead to better outcomes, what are the process conditions that lead to better outcomes. So in the 22 local authorities that we did this last year, there's a very powerful read across from good process to good outcomes. And we're increasingly able to be clear in some detail about what those elements of good process are. But what gets reported very powerfully and very consistently in those surveys is people are reporting in important areas of their lives improved outcomes since receiving a personal budget, but screaming loud and clear about process. Probably, and they're all kind of aspects of process, and you don't need me to tell you this, but probably the thing that we are getting most on our helpline at the moment is people saying, why couldn't I use my personal budget for that? I understand there are issues about restrictions in how much money I can have, and I understand there are outcomes that need to be achieved with that money. But if I can identify a way of achieving those outcomes that the council agrees should be met in a better, often cheaper way, why can't I do that? There's all the other kinds of stuff that we've been addressing in the bureaucracy busting stuff we've been doing with yourselves over the past 6 months or so. We're in there, why can't social workers sign off up to a certain level? Panels are overused, all that kind of stuff was in there as well. So as I say, there's an increasing body of evidence concerning what works best in implementing personalisation, and there's still massive amounts of learning to be done. But there probably is enough now out there for us to be able to identify if you implemented these kinds of activities, you are likely to achieve improved results without cost problems. And the critical thing that Poet shows us is that some councils who aren't any better funded than other councils are managing to achieve significantly greater outcomes for people. So there must be something that we can implement from that. There was strong welcome for the Care Bill and its key themes and approaches, but a strong concern and sense of challenge to make sure that the regulations and guidance emerging from the Care Bill lever and support personalisation, so that we identify the things that make it real. And as far as we can, we lever those into regulations and guidance without kidding ourselves that either legislation or regulations and guidance make that happen. It's an understatement to say that I guess there was a strong view that there's a long way to go yet to ensure a diverse market of high quality personalised care and support. And there were a lot of examples shared around commissioning practice that ran counter to achieving personalisation, some of which did seem to be things that could be changed at the local level, some of which people were finding very cumbersome in relation to things like EU procurement rules, etc. Some of which might be responsive to government action, some of which need local attention. People talked about some of the ways in which people are moving from just using personal budgets on an individualised basis and looking at opportunities for things like pooled personal budgets. And there are examples of that starting to pop up, but they're relatively rare. And as Sue says, a relative lack of the infrastructure needed to support people to develop their own plans and commission services for themselves. And a strong sense that that's still being mostly internally done rather than looking for some of the opportunities to do it more effectively externally through peer support and such like. Back to this issue that I raised earlier on about, is the financial context driving risk-averse behaviour? So, the first thing that was said at the summit, really, the term elephant in the room is used all the time now, isn't it? We are working in this unbelievably financially constrained situation. I stopped working directly in local government some years ago now. I've never had to do what some of you are doing. But, which of the underminings of personalisation are down to real issues about resources, and which of them are about the way we're tackling the reduction in resources inappropriately, is the question. There was a strong theme of workforce issues, some of that around how do you support a workforce to do something very different from what they've done decades past. And the positive role of social workers. The chief social worker was in the room, and we had some conversations which I know are going to be followed up around a clear narrative about the function of social work in personalisation. Sometimes it feels like adult social work is almost in an existential crisis, but it needn't be. And last but absolutely not least, and I see Sarah's in the room, and you will probably be emphasising this one quite a lot, I would say. More attention needed to evidencing the business case for personalisation. How can personalisation be part of the solution, not an addition to the challenge? There was quite a lot of what's the word I'm looking for? Harking back to the days of the Care Service Efficiency Delivery Programme. Everybody remember that? Some people might have been involved in it. But practical ways in which real world efficiency solutions can be done alongside and in powerful synergy with personalisation, as opposed to being two opposing agendas. There was a proposal, bring back CSED or something like that. I should say also that there was also a request for some DOSH. I look at Shaun. The big request for DOSH obviously is about a funding settlement that's going to work. There was some conversation. I imagine this money's been spent several times over now, but the 3.8 billion integration fund, how could that be levered in helpful ways in respect of some parts of the agenda? But also, I remember when the bill was in the engagement stage, David Behan saying, remember David Behan? Didn't seem that long ago. David Behan saying loud and clear that the two game changers, as he described them, that he'd seen in his career in social care were direct payments and the special transitional grant. Remember, people old enough to remember the special transitional grant when community care came in? That was money that was targeted. How do we shift when there isn't enough money in acute long-term services, how do we shift to prevention? How do we make some adjustments to our system? So that could be a big money conversation, or it could be a, well, you know, Norman, if you're going to go around the laggards, or whatever you want to call them, and help them to improve, you know, just telling them to improve ain't going to do it. They're going to need some help. And there was some concern expressed by John Rouse at the summit about what might be termed rewarding failure. Why would we just give some money to people who haven't been doing their jobs properly over the past few years, I suppose, to put it crudely. But there was also encouragement to support innovation. You know, so a fund like that, if it was available, wouldn't simply be targeted to people that were really struggling, but could be targeted to people who were making significant progress to stretch further and to share that effectively. Last couple, personal health budgets. I think this is one that interested me in the summit because there was a presentation from NHS England about personal health budgets, and particularly the possible function of personal health budgets in helping solve some kind of wicked problems that are being faced and playing a significant part in the integration agenda, and a feeling like the integration agenda is probably too much around system and service integration and not about integration at the level of the individual that the individual has control over, and the prospects of personal budgets there. But a sense that there isn't powerful traction at all in the NHS for personal health budgets, and unless there is some kind of intervention, the chances of that changing are probably not high. And so it was interesting to me that listening to some of the suggestions that were being made in that presentation, Norman Lamb saying to John Rouse, write that down. He said that on several occasions, with some practical suggestions about how to move this agenda forward. And one of them is in respect of the Pioneer Programme, the Integration Pioneer Programme. So one of the things that Norman Lamb got John Rouse to write down was, let's make sure that some of the Pioneer Programme authorities are using personal budgets and personal health budgets, or else, you know. So what next? Following the summit, a planning group coordinated by Think Local Act Personal will be working over the next month, so with representatives present at the summit and the opportunity to read proposals back to all those present. The idea is that we'll get to a position where we've got an agreed review of personalisation progress that can be agreed across the sector, drafted and shared at the NCAS conference in draft form in October. We'll have a draft action plan there, hopefully, and then a more detailed action plan to developed over a couple of months subsequent to that. And as I say, this idea of maximum connectivity, trying to link what happens in legislation and policy with what TLAP and others are identifying seems to work, with what Towards Excellence in Adult Social Care and the Sector-Led Improvement process is supporting on a peer-to-peer challenge and support basis in local areas, and what provider organisations and consortia are able to do to support their members. Bridget smiles as I say that. I didn't forget to say that. So I was going to go and tell you a bunch of great things that TLAP are doing, but I'm not going to do that because I think it's really important now that as I say, this is a live part of the process.